Welcome to my channel.
Swollen feet can have causes that aren't due to underlying disease. Examples include a sprain or strain, fluid retention from large salt intake, prolonged time on feet, standing or walking, menstruation, pregnancy, or medication side effects. A person may experience swollen feet for several reasons, from hot weather or pregnancy to more serious health conditions, like heart disease or a blood clot. Treatment for swollen feet depends on the underlying cause. Here, we take a look at some of the reasons why a person's feet may appear swollen, when they should talk to a doctor, and what the treatment might involve. 1. Edema. Edema is the medical term for swelling that occurs when fluid becomes trapped in the body's tissues. It usually affects the legs and feet, but can also occur in other parts of the body, such as the face or hands. Other signs of edema include shiny, stretched skin over the affected area, skin that stays dimpled after pressing it, discomfort and reduced mobility, coughing or difficulty breathing. If it affects the lungs, treatment edema may go away by itself, or there may be an underlying cause that needs medical treatment. Home remedies include wearing support stockings, reducing salt intake, and lying down while raising the legs above the chest. If the swelling does not improve, a person should talk to their doctor to check for any underlying causes. 2. Foot or ankle injury. Trauma to the foot or ankle can cause swelling in this area of the body. For example, a sprained ankle, which occurs when the ligaments become overstretched, could cause the foot to swell. Treatment to treat a foot or ankle injury. A person should elevate the foot when possible and try not to bear weight on the affected leg. Using an ice pack or compression bandage can help reduce swelling, and over-the-counter pain relievers can help ease discomfort. If the swelling and pain do not go away, a person might need to see their doctor to rule out more severe damage. 3. Pregnancy. A common symptom of late pregnancy is for the feet and ankles to swell. This swelling is due to fluid retention and increased pressure on the veins. Home remedies to treat swollen feet during pregnancy. Women can elevate their feet where possible, wear comfortable and supportive footwear, and avoid standing for extended periods. Staying cool, avoiding salt, and increasing water intake can help reduce fluid retention. Wearing supportive clothing, such as tights or compression stockings, should also reduce discomfort and help the swelling decrease. 4. Preeclampsia. If swelling during pregnancy comes on suddenly and is severe, it could be a sign of preeclampsia. This is a condition that can occur during pregnancy or immediately after pregnancy. Symptoms include protein removal, rapid excessive fluid retention, and high blood pressure. This is a medical emergency that usually occurs in the latter half of pregnancy and can progress to eclampsia, which is even more dangerous and constitutes a medical emergency. Signs of preeclampsia include severe swelling, headaches, dizziness, nausea, and vomiting, vision changes, less frequent urination, high blood pressure, seizures. Treatment. If a pregnant woman experiences any of these symptoms, she should speak with her doctor or midwife straight away. 5. Lifestyle factors. Some lifestyle factors can also lead to swollen feet. These factors include having a sedentary lifestyle, being overweight, wearing fitted shoes, consuming a diet high in salt, home remedies, exercising regularly, and maintaining a healthy weight reduce the risk of swollen feet. Other ways to alleviate swollen feet include wearing compression socks or stockings, soaking the feet in cool water, raising the feet above the heart, regularly staying active, losing weight or overweight, eating a healthy diet, and being mindful of salt intake, massaging the feet and socks. A side effect of medication. Taking certain medications can result in feet swelling, especially if they cause water retention. Medications that may cause the feet to swell include hormones such as estrogen and testosterone, calcium channel blockers, blood pressure, steroids, androgenic or anabolic non-steroidal anti-inflammatory drugs. Medication to help manage diabetes. Anyone who thinks that their medication is causing their feet to swell should speak with a doctor, who may be able to alter the dosage or prescribe a different type of medication. 7. Alcohol. Alcohol can cause the body to retain excess water, causing the feet to swell. If the swelling continues for more than 2 days, a person should make an appointment with a doctor. Recurrent swelling of the feet after drinking alcohol may be a sign of an underlying issue with the heart, liver, or kidneys. Home remedies. Elevating the feet above the heart, drinking plenty of water, and reducing salt intake may all help minimize swelling. Soaking the feet in cold water can also relieve symptoms. 8. Hot weather. During hot weather, the feet can swell trusted sores because their veins expand to cool the body. This process can cause fluid to leak into the surrounding tissue. Fluid can also collect in the ankles and feet. Home remedies. Drinking plenty of water and wearing well-fitting, comfortable shoes that allow some ventilation can help prevent the feet from swelling in warm weather. Compression stockings may also help. 9. Infection. An infection can cause swelling in the feet and ankles. People with diabetes have an increased risk of infections affecting their feet, so they should remain vigilant for any changes to this part of the body, such as blisters and sores appearing. Treatment. A doctor will typically prescribe antibiotics to treat infections. It can also be a serious condition that requires emergency treatment to prevent more serious infection in the blood. 10. Venous insufficiency. Venous insufficiency occurs when venous blood does not return to the heart and pools in the legs. This is due to damaged valves causing blood to leak down the vessels. This can cause fluid retention in the lower legs, particularly around the feet and ankles. Signs of venous insufficiency include trusted sores, achy legs, skin changes, new varicose veins appearing, skin ulcers, infection. Treatment. A person experiencing any signs of venous insufficiency should make an appointment with their doctor as soon as possible. To treat venous insufficiency, a doctor may recommend making some lifestyle changes, such as taking up exercise to help keep the blood pumping around the body efficiently. Compression stockings and medication to prevent blood clots can also help. In some cases, a doctor may suggest surgery to try to repair the damaged valves. 11. Blood clots. Blood clots occur when the blood fails to flow around the body correctly, causing platelets to stick together. If blood clots develop in the leg veins, they may prevent the blood from moving back to the heart. This can cause the ankles and feet to swell. Deep vein thrombosis. UTE occurs when blood clots form in the legs. UVT is a serious condition that can cause a blockage of the major leg veins. In some cases, the clots may break loose and move to the heart or lungs. Signs of DVT include swelling in one leg, pain and discomfort in the leg, low-grade fever, color changes in the leg. Treatment. If a person notices any signs of DVT, they should seek urgent medical attention. The doctor may prescribe blood-thinning medication to treat blood clots. People can help prevent blood clots by wearing tights, compression stockings, or clothing that is loose-fitting around the ankles. Other prevention methods include keeping active and reducing salt intake. It is also best to avoid standing or sitting still, especially with crossed legs, for extended periods. 12. Lymphedema. The lymphatic system helps the body get rid of unwanted substances, such as bacteria and toxins. Lymphedema occurs when lymphatic fluid gathers in the tissues as a result of problems with the lymph vessels. If the lymph vessels are damaged or absent, lymphatic fluid can build up and lead to infection, slow wound healing, and even deformity. People who undergo radiation therapy or lymph node removal have a higher risk of lymphedema. Anyone who has undergone cancer treatment and experiences swelling should contact their doctor immediately. As well as swelling of the feet, signs of lymphedema include trusted sores, recurrent infections,